Celiac disease is a condition that affects around 1 in every 100 people in the UK. Celiac disease is an autoimmune disease and is linked to type 1 diabetes, which is also an autoimmune disease. Around 1 in every 10 people with diabetes also has celiac disease, so it's not uncommon to have both type 1 diabetes and celiac disease. Celiac disease is an autoimmune disease that causes inflammation of the small intestine when gluten is eaten. Gluten is a protein found in wheat, barley and rye and is therefore present in a range of products including bread, pasta, cereals, tinned soups, packaged foods containing sauces. Inflammation of the small intestine can mean that the body struggles to absorb nutrients properly. The symptoms of celiac disease can range from mild to severe. The classic symptoms of celiac disease are indigestion, stomach pain, bloating, diarrhea or constipation. Other symptoms that may be present include delayed growth, weakness, anemia, bone and joint pain, weight loss, skin rash, nerve damage, neuropathy. Some people with celiac disease may be diagnosed without noticing symptoms. People with the following conditions may be recommended for a screening for celiac disease: type 1 diabetes, irritable bowel syndrome, underactive or overactive thyroid, dermatitis herpetiformis, a skin condition. Diagnosis of celiac disease initially involves a blood test to check for specific antibodies. If these antibodies are present, a biopsy of your small intestine will then be taken. Both diabetes and celiac disease means you need to be careful with what food you eat. Having celiac disease means you need to avoid food which contain gluten. Having diabetes means you need to be careful of the amount of carbohydrate that you consume. People with celiac disease need to keep to a gluten-free diet. Many foods do contain gluten, but there is a growing number of foods in supermarkets branded as gluten-free. You'll be referred to a dietitian who will be able to make sure you keep to a well-balanced and gluten-free diet. People with celiac disease can also get prescriptions for gluten-free foods such as bread and flour. The JDRF, a charity for people with type 1 diabetes, note that people with both type 1 diabetes and celiac disease have a higher tendency to experience unexplained bouts of both high and low blood sugar levels. As a result of this, people with both type 1 diabetes and celiac disease may need to check their blood sugar levels more regularly.